I've been an extreme snowboarder for about 30 years.
Are you
So top of
serious?
the mountain, as steep as possible. Uh, and so I love being outdoors. We actually teach people clinically how to use nature to help heal because there's all these scientific articles about how nature helps human health and well-being. So we actually treat people how to access nature, whether they're in a big city, can't even get out of their apartment, local park.
You're listening to Cold Press Conversations with Dr. Jewel White Williams, a lover of numbers, lists, and a good glass of cold pressed juice, who is sharing episodes each week to help you explore the back end of healthcare and health sciences. Where a lot of that grit is done, we'll dive into topics covering research, education, and clinical practices, as well as guest shows with other leaders in the field. Pull up a seat and let's dive into these amazing and game-changing conversations.
Mhm.
Innately, you teach. Innately, you research. And that's what gives you the best practice. And that's why I was definitely excited to have you join in, because one of the things that I read within your biography, which we're getting ready to talk about in just a second, you focus on functional medicine. So, ladies and gentlemen, I just want to say I am Dr. Jewel White Williams. I have a doctorate in health science from the University of Bridgeport, very proudly. And I have focused on the clinician side as well as the education, the higher education side. I also have a master's in education leadership. I have Dr. Bilstrom here. He is a fellow of the American Academy of Integrative Medicine and American Academy of Medical Acupuncture, as well as an advanced fellow in anti-aging, regenerative, and functional medicine. Dr. David Bilstrom is a quadruple board certified in functional and regenerative medicine, integrative medicine, physical medicine and rehabilitation, and medical acupuncture. Dr. Bilstrom is the director of the International Autoimmune Institute and the Bingham Memorial Center for Functional Medicine, the first medical center in the country associated with a teaching hospital to treat all types of autoimmune diseases. It is also the first to use nature and its ability to improve human health and well being as an integral part of a wellness program. Dr. Bilstrom, once again, thank you so much for joining me here on Cold Press Conversations. And I believe we're going to have a fun time today.
Thank you for having me.
No problem. Earlier we were having just a slight discussion so that we can kind of get used to just the rhythm of who you and I are. And we talked about how you really and truly focus clinically on teaching people how to access nature. And as an active snowboarder, which we'll get into later, we know that functional medicine is different from conventional medicine treatments for autoimmune disease. Can you elaborate how your approach is different?
Sure. So functional medicine ideally identifies why somebody has the health issue they do. And if we know why somebody has a health issue or why somebody might end up with a health issue, we're in a position to prevent it from happening in the first place or reverse the whole process in general. And then because we took care of the why they have whatever they have currently, we've set them in a good position so they don't keep letting that why keep pushing them in the wrong direction as time goes on and get a second thing and a third thing and a fourth thing and a fifth thing. More traditional allopathic medicine, a lot of times, is taking care of a symptom or two of a particular health issue with a medicine, but that medicine doesn't necessarily and rarely actually gets at why they got in the first place. And then the why keeps pushing them, and now they need a second medicine or a third and a fourth. And they all come with side effects. You start getting drug interactions, adverse drug interactions. And so ideally, we're in a position really to reverse chronic health issues that people may think that they're, well, this is what I'm going to have forever. Well, not
Mhm.
necessarily. We can actually have your body reverse the process.
You were discussing looking at, I always like calling it the superficial surface. It's like looking at the skin. You know how we have the several layers of the skin? You're trying to diagnose exactly what's actually transpiring with that patient.
Yeah, in our world in general, we tend to make prevention look very complicated, but also at the exact same time very vague. And so
Mm.
somebody will say, well, I see this in my family. and my parents, grandparents, I see this in my community, I see this in friends. Well, I'd rather not have this, get this, whatever
Mhm.
this health issue is. How can I prevent from getting these health issues? And oh, you need to change how you eat and you need to exercise. Well, that sounds very vague, but very complicated. Like, well, what kind of change in exercise? What kind of change in food? And, all this, where if you really know the language the body speaks, it doesn't have to be hard to prevent things. The body's so smart. If you can make sure you kind of give it what it needs and kind of take away what it doesn't need, it really is in a position. That's what it does. It stays healthy. It resets things. It fixes things. It rebalances things. And so, a good example I use is a very big central mechanism in health or ill health is vitamin D levels. And ideally, it's a simple blood test you can do anywhere. It's not complicated. And we want a vitamin D level on a blood test between 70 and 90. Now, most people are very low. It's really hard for humans to make vitamin D from sun exposure nowadays. Most people think, well, I get it from the sun. But
Mhm.
lifeguards in San Diego are in the mid 40s. They're like 40 points lower than they should be. The darker your skin tone, the harder it is to make vitamin D. And so many people are under 20, even single digits. It's terrible. But if a woman gets her vitamin D above 60, she has automatically decreased her risk of ever getting breast cancer by 82%.
Whoa, you're talking that scientific data stuff. I'm a geek. I'm loving it. Go for
And
it.
if a woman's vitamin D is above 50 during pregnancy, still far from where it should be, she's
Right.
automatically decreased the risk of her child ever getting multiple sclerosis by 50%, cut in half. We'd have
Wow.
100 less cases of multiple sclerosis every week in the US if women just got their vitamin D level above 50 during pregnancy. A fantastic study out of northern Finland where they took every child born in northern Finland in 1966 and they said, okay, we're going to follow you guys for 31 years. But for the first year, we want half of you guys to take 2,000 IU per day, first year of life in infants, and the other half, we don't care what you do. We're going to follow you. Well, they saw an almost 90% decreased risk of type 1 diabetes simply by giving 2,000 IU per day the first year of life. Doesn't matter what they did after the first year. But this is where we really like to teach people how to prevent stuff, including prevention really starts even before conceiving a child, during a pregnancy. Hey, we can, 50% decrease risk of MS just by getting your vitamin D up a little bit. And first year of life, oh my gosh, that set the system well. And what they saw was that these kids that got the vitamin D first year of life, they didn't end up getting schizophrenia. It's so great for brain health, not just immune health, but they didn't end up getting schizophrenia either. And it's like, oh my goodness, with all the brain stuff we have going on nowadays and the autoimmune stuff we have going on nowadays, just doing a few things early in life can set the system for the rest of that person's life. But because we know so much of this stuff, even if somebody's got a well established chronic health issue, we're in a position to reverse it.
Okay, so you just gave a lot of gems here. Pardon, I'm Jules, so I kind of use that word. So you gave
I
you
like
gave
that.
a
Oh,
lot of
good.
gems. So, when I read some more of your biography, you mentioned the importance of resetting your epigenetics before the age of 19 to prevent these
Yeah.
chronic diseases. And what you've just done is given us some true gems talking about scientific data. And I'm going to just repeat it. And I want you to correct me if I'm wrong, because I want people to understand that what you're talking about has to be done first with a professional, someone who understands functional medicine. You have to look at, or the other physician needs to look at all of your levels. You just can't go out there and go to the local drugstore and get your vitamin D. But you were telling us some serious information. The vitamin D levels must be between 70 and 90. Is that correct?
That's optimal. Now, if you
Okay.
have Parkinson's, you probably need to
Oh.
be above 100. If you have cardiovascular disease, you've already had a heart attack and stroke, you probably need to be above 95. But the research out there says we probably need to be above 75 in general to cover all the bases as well as we
Mm,
possibly can. Even
mm.
though even getting the levels up, higher than they would be without it, like just getting above 60, well, you're not optimal, but you've already decreased breast cancer risk by 82%. So a little bit
Mm.
can go a long way, but you're right. If it gets optimal, that's when we cover all the bases as best we can. There's a few more gems, I think, in that one too.
It was. How'd you know? Can't you see it in my face? So, this is what I have from you, Dr. Bilstrom. you talk about the different types of diseases that from just vitamin D alone. We haven't even got to the other amazing information that you've given us. But if I'm correct, you mentioned brain health. You talked about the psychotic episodes that some people have because of psychological issues. You discussed type 1 diabetes, breast cancer, cardiovascular. Vitamin D plays a role in so many areas of our body makeup.
Mm-hmm.
Is that the only vitamin that you tend to focus on when you're looking at resetting the epigenetics of an individual?
Well, if you get at the real big central mechanisms, the body has a tendency to fix a lot of things all by itself. A patient may come in to see me with chronic health issues. They've done so much homework. They've read, they've listened to people talk. They come in with like 50 different supplements. And I can look at their 50 different supplements and I'm like, boy, this person has really done their homework. Every one of the things that they're on makes perfect sense given what they have going on. But what they're missing is the central mechanism. They still can't get where they need to go, even though everything they're doing is logical, makes sense scientifically. So this is where we talk. If you can really get these central mechanisms, though, we talk about 7 central mechanisms, then your body basically kind of fixes everything else. And so vitamin D is very important. I referenced my respect for the researchers at University of Illinois Chicago because they do some really neat stuff, including the ones that figured out about vitamin D receptors. And so one of the things that makes vitamin D so important is every cell in our body has receptors for vitamin D, so it can attach and tell the cell what to do, basically.
Mhm.
Just like every cell in the body has receptors for insulin, so the pancreas makes insulin, attaches to the cells so that we can control blood sugar. But people are
Yep.
quite familiar with insulin resistance, where
Mhm.
the receptors become resistant. Insulin can't attach. It's almost like you don't even have insulin. Then you start going to prediabetes, diabetes. Well, it turns out the vitamin D receptors in the gut are even more numerous than vitamin D receptors anywhere else in the body. And the researchers go, oh my goodness, this is why vitamin D is so important for the gut. There's more vitamin D receptors in the gut than any place else. But these vitamin D receptors become resistant to vitamin D. And this is where you can have all the vitamin D in the world, just like all the insulin in the world. It can't attach
Mhm.
and do the work. Well, this is a super central mechanism for not only gut health, but everything. And so when you can fix that vitamin D receptor resistance in the gut, make it sensitive again, the original researchers in 2018 from University of Illinois Chicago said, "Oh my gosh, this is what you want to fix in order to turn around all autoimmune disease of the gut, ulcerative colitis, Crohn's disease, get rid of recurrent H. pylori and C. diff infections of the gut." But oh my goodness, this looks like exactly what you probably want to do for everything. And they named off all these things. Well, then 6 months later, another article came out. They go, oh my goodness, you fixed the gut by fixing the vitamin D receptor resistance. It is a nuclear weapon against metabolic syndrome. Quote unquote on the title, nuclear weapon, insulin and blood sugar, abnormal weight gain, triglycerides going up, and 2/3 of Americans are pre diabetic. Here's a nuclear weapon against it. Well,
Wow.
all this research since 2018 is like, oh my goodness, it does work for this, this, and this. And so you mentioned brain health before. So, like 2 years
Mhm.
ago, Harvard Journal of Psychiatry came out and go, well, if you can fix the intestinal microbiome this way, the mix of the good, bad bugs in the gut, and I'm like, oh my goodness, that's what happens when you fix the vitamin D receptor resistance. They say, oh, you can use this to treat major depressive disorder. It works so much for brain chemistry. And then another psychiatric journal 6 months later goes, oh, well, if you can fix the intestinal microbiome this way, I go, oh, that's the same thing. It changes personalities. People become more outgoing and more social. It has such this impact on brain chemistry. So it turns out this is a really big mechanism, having the right amount of vitamin D, but having vitamin D receptors that are sensitive, including you mentioned epigenetics. And
Yes.
we have a lot of bad genes in our cells. We got to turn them off. A lot of good genes we got to turn on. So it's not what genes you have necessarily, it's which ones get turned on and turned off. And so things like, meditation, yoga, getting out of nature, deep breathing, repetitive prayer, it works through epigenetics. It flips genes on and off. Harvard did a lovely study about 16 years ago about that. But we talk about things like, oh, we have this epidemic of young people but also adults now with type 1 diabetes. Well, there's genes that make predispose people to type 1 diabetes. Yeah, okay, but how do you turn them off? Right? Well, it turns out vitamin D attaches to vitamin D receptors.
Mm-hmm.
Vitamin D receptors release a protein called vitamin D responsive elements that attach to the receptors on the genes that code for type 1 diabetes, turns them all off.
Mm-hmm.
Every gene that codes for type 1 diabetes gets turned off by vitamin D and vitamin D receptor health. This is why they call these genes that code for type 1 diabetes vitamin D responsive genes. And I'm like, oh my gosh, what a central mechanism, not only for the things that you see in a lot of, studies about health, but we're like, oh my goodness, this is working through genes. This is turning off the genes that try to push us the wrong direction, including type 1 diabetes used to be considered, well, that's childhood diabetes. Adults get
Mm-hmm.
insulin resistance, type 2 diabetes. But now so many adults' pancreases stop making insulin. They actually need insulin. Oh my goodness, we can actually shut those genes off and do so many things when we kind of know how the body's language works and this epigenetics, how to flip off the bad and turn on the good.
Whoa. Okay. So you mentioned several studies that have assisted you in this process to ensure that you're meeting the needs of your patients. And you mentioned a study from Harvard. That piqued my interest because it
That was a
sounds
good
like
one.
you also use some of the tools that they speak of with treating your patients. Did I hear you correctly?
Absolutely. And this is where the researchers are doing such beautiful work, but it doesn't really get into the clinical setting as much as it should. So the Harvard research published 16 years ago, there was two previous studies. The second one was in India that suggested that meditation might work through epigenetics, flipping off the bad genes, turning on the good genes, which basically is how you want to, prevent or reverse any chronic health issue, right? Because when the genes are flipped the wrong way, the genes, the DNA are telling the cells the wrong information, and then cells start doing the wrong thing. You start flipping
Mm-hmm.
them the right way, well, it's happening in the entire body, every cell in the body at the same time. So now the cells are being told the right information. So this is why it can impact so many things. So Harvard said, well, that's interesting. We're going to do the quintessential study to see if this is true. So we're going to take our best research, their very best researcher at Harvard, to get on this. So they took this large group of people that had been doing some kind of relaxation, something, meditation, deep breathing, progressive muscle relaxation, visual imagery, repetitive prayer, all these kind of things every day for between 3 and 28 years. Took this other group that had never done this stuff. And they checked their epigenetics. Well, what they found between the two groups is that there was 2,000 genes that were turned on and off differently between the two groups. 2,000 genes expressed differently between the two groups. And they go, oh, this is fascinating. So now what we're going to do is teach this group that never done this stuff. We're going to teach them how to meditate. And we're going to ask them to meditate for 30 minutes a day, 5 days a week, for 8 weeks. And then we're going to retest them. 8 weeks later, they retested them. Well, human nature being what it is, here's Harvard, top researcher, top research area. They can't get people to do it right. So they said, we just need you for 8 weeks to do 30 minutes, 5 days a week. On average, the people did it 15 minutes, 3 times a week. So I always kind of
Okay.
tell my patients, who am I to expect you to do exactly what I ask you to do? Harvard can't do that, even for 8 weeks, but that's
Mm-hmm.
okay. The body's so smart,
Yeah.
we don't need perfection. So what they found is with just this little bit of meditation for 8 weeks, and they retested the new meditators, those 2,000 genes that were expressed differently between the two groups. Now 400 in the new meditators had flipped to match the long-term meditators. And they go, oh, that's fascinating. What do those 400 genes do? They code for inflammation. And Harvard says, oh my goodness, this is what you need to do if you're going to keep away the inflammation that drives chronic health issues. This is exactly what you want to do for everything. And they named off, cardiovascular, depression,
Yeah.
anxiety, autoimmune, cancer, all this kind of stuff, because this truly is what you need to do if you're going to stay healthy, is just optimize epigenetics. And truly, the body is so smart. Here, they only did it for 8 weeks. For me, I'm like, well, I knew this was going to turn out this way because I've seen it done with other sort of interventions. So why wouldn't meditation do it this way? But I thought the main thing was it only took him 8 weeks. It's not like you got to do this stuff for like 8 years. And they only did it for 15 minutes, 3 times a week. You don't need to be perfect. The body's so smart. You give it a little bit. Oh my gosh, does it just run with it? And it impacts everything at the same time.
Oh, wow. All right. So this meditation is through Harvard, even though they were focusing on 30 minutes, 5 days, 8 weeks. All of us know who focus on research. Unfortunately, there's some variables that actually don't go all the way we like it to go. And so it ended up being that when they reviewed the information, people were doing closer to 15 minutes 3 times a week. And it affected the epigenetics, assisted 400 of the genes, focusing on the inflammation that helped, correct? It helped with inflammation,
Yeah.
which when you named some of the areas that it affected, which involved inflammation, it hit some of that metabolic part too,
Yeah.
the metabolic syndrome.
Mm-hmm.
Loving this. Okay. Told you I'm a geek on my research. The second, then what also came to be is that you started talking about the gut health.
Mm-hmm.
And when you mentioned gut health, it brought up so many things. But when we talk about gut health, we have prebiotics, probiotics. If I could just steal away a little bit of your time, do you mind helping us understand how, when you talked about the epigenetics, metabolic syndrome, vitamin D, is there any way that that relates to how you elaborate on your statement dealing with aches and pains of aging, where you make it very clear you shouldn't have any aches, you shouldn't have any pain until you're 90?
Mm-hmm.
Am I correct?
That's correct.
Everything you've mentioned literally focuses on and correlates with aches, pains that people are having. And ladies and gentlemen, Dr. Bilstrom is letting us know that we shouldn't have any aches and pains until we're at the age of 90. How does that even work? Like, is what you're talking about literally help with acquiring the aches and pains only until you get 90?
You want to remember is every health issue comes from the same thing. It just shows up differently in different people.
Mm-hmm.
And so the bigger statement, I think, is nothing is age related until at least 90. If you have a health issue, health challenge, and you're not 90, you're younger than 90, it's not age. Even though people kind of think this, I get people in their 20s with all these health issues. I think I'm getting old.
Oh,
And I'm like,
wow.
no, 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 no. That's not how it works. You're in the 20s. But I get people in their 50s and 70s that say the same thing. I'm like, no, that's not how it works. We know so much about human longevity nowadays that truly people should be able to live happy, healthy lives until at least 90. Now, the data suggests it might even be later than that. But we've kind of historically said, well, if you got some health issue before 90, it's something. It's coming from someplace, but it's not age. But we should be able to figure it out and turn it around. So the same thing with its aches and pains could be brain fog. It could be metabolic syndrome. It could be gut issues. It could be skin issues. It could be eye issues, all this kind of stuff, cardiovascular disease. It's all
Mm-hmm.
inflammation. Just depends on where your weak spot tends to be. And that's where your inflammation is going to create a chronic health issue. And the gut is such a central mechanism with all this stuff, including what they call the intestinal microbiome, that mix of good, bad bugs in the gut. We want a lot
Yeah,
of good,
loving
not a
it.
lot of bad. So that's where you kind of talk about prebiotics and probiotics. The probiotics are basically good bacteria that we could take orally to try to build up our good as we're trying to get rid of the bad. And
Mm-hmm.
the intestinal microbiome is the first one that people really start paying attention to. But what's important to know is that every body part we have has its own unique microbiome. The palm of our dominant hand has a different microbiome than the palm of our non-dominant hand. Back of the hand, palm, elbow crease. The intestinal microbiome actually starts developing before a child's born. We used to think the child, when they're born, has a sterile gut, but actually, good or bad bugs cross from the mother to the placenta, across the placenta to the baby, even before
Mm-hmm.
birth. They're starting to set up the intestinal microbiome even before birth. Now, within about a couple of weeks, there's 1,000 new, ideally good bugs that now have populated the baby's gut. So really quickly it builds, but it's already there from the beginning. This is where vaginal delivery is better than C-section delivery. This is where breastfeeding is better than formula feeding because it really gets the microbiome going. But it really forms quite quickly. But every body part has its own microbiome, and that body part's not going to be as healthy if that microbiome is disrupted. And so one of the things that makes the gut so important, you want to have a good mix in the gut, but that'll keep the gut healthy and it won't develop what they call a leaky gut, which is
Hmm.
more technically an intestinal permeability disorder. So there's these tight junctions in the wall of the gut that only let some things in, but not other things. So they would let in vitamins and minerals. They would let in nutrients. They're not going to let bad bugs from the gut through the wall into the bloodstream. You
Hmm.
have bad bugs that got kind of crap that needs to be pooped in the toilet. Well, it
Yeah.
shouldn't get through the leaky gut in the bloodstream. But there's certain viruses, for example, like adenoviruses, and these adenoviruses with a leaky gut can translocate from the intestine through the leakiness in the bloodstream and go to different body parts. Then they're starting to talk a lot about these intestinal microbiome breast axis, for example, or intestinal microbiome pancreatic beta islet cell axis, the ones that make insulin. So these adenoviruses can translocate through a leaky gut to the breast tissue, disrupt the breast microbiome, increased risk of breast cancer.
Wow.
Translocate to the
Okay.
cells in the pancreas that make insulin, stop them from making insulin, type 1 diabetes. And so this is where, the mix of the good, bad bugs, probiotics, prebiotics that feed basically fiber that feed the good bacteria, uber
Mhm.
important because you got to keep the gut from getting leaky. Otherwise, things from the gut start going out and start messing up the microbiome and other body parts as well. Then they even talk about the intestinal microbiome brain axis. That's kind of that gut brain connection that so many people have heard about,
Yeah.
but there's also connected with breast and pancreas and all this different kind of stuff.
Wow. Okay. Thank you for answering that for me because I think often we read a lot, we hear a lot about prebiotics and probiotics. We hear about the leaky gut, we hear about the gut and how it plays a role in our brain health. And you've allowed us to get that true connection. Now it's time for the fun part. What do you do on your off time? Because I know you have a busy schedule, Dr. Bilstrom. So, what do you do for fun? What do you do for fun?
Oh, you're going to be the greatest podcaster ever. That's a lovely first question.
Oh, thank you.
Well, I'm a former Division One tennis player.
Wow.
So I got to do a shout out to TCU, ranked number 2 in the country right now. But I do love sports. I'm currently down at the NCAA men's basketball tournament in Salt Lake with my son, and all 3 of my alma maters are still in the tournament. So TCU's in the tournament. That's my undergrad. University of
Mhm.
Illinois, where I went to medical school, they're in, and University of Colorado, where I did my residency, they're in. So it's like probably a once
Oh
in a
my goodness,
lifetime.
you're
All
the
three
best
are
of
in.
both worlds
in
here. Well, the triple world.
Oh, it is. It is great. And they're not playing each other, so they could keep winning quite a bit before they ever get together. And then because I did my residency in Colorado, been an extreme snowboarder for about 30 years.
Are you
So top of
serious?
the mountain, as steep as possible. So I love being outdoors. We actually teach people clinically how to use nature to help heal because there's all these scientific articles about how nature helps human health and well-being. So we actually treat people how to access nature, whether they're in a big city, can't even get out of their apartment, local park, even where
Wow.
we're at out here in the dry part of the Pacific Northwest by the Rocky Mountains, the Grand Tetons. We have Yellowstone right down the road about an hour, but people can utilize nature even with home gardening. And so I love to be out in nature, and we love to teach people how to use that to heal.
That is awesome. I'm having some amazing guests, and you are the one that's a snowboarder, so I think you're topping it. So you actively still
Well,
snowboard?
thank you. What's that?
Do you actively still snowboard?
I do. I do often, including I do backcountry snowboarding where you have a snowboard, you can pop it lengthwise into 2 parts, you flip it over, you put skins on the bottom so you can go uphill, like cross country skis almost, and then you get to the top of the mountain outside the resorts, you flip it back, put it back together as a snowboard, then you snowboard down.
You know about what it takes to have a healthy lifestyle.
I know the science that the wonderful researchers have done to tell us that information. I wouldn't be where I'm at now if it wasn't for the researchers. Give a shout out to University of Illinois Chicago that they've done some fantastic
Mhm.
research. And what I tend to find is there's such great researchers out there learning things, telling us things, but it doesn't always get into the clinical, what we do for patients, which is a real shame. But there's so much great clinical data that we can use to help prevent and reverse chronic disease. But we got to have great researchers to give us that info.
Thank you for joining me with Dr. David Bilstrom. This cold press conversation was amazing because he has an opportunity to meet the needs of so many patients from a functional medicine side while also using conventional medicine. I do want to let you know that Dr. David Bilstrom teaches practitioners how to reverse and prevent autoimmune disease so they can avoid burnout while building and fulfilling practice and waiting lists of eager patients. He empowers patients with the knowledge and tools to test and treat their chronic conditions. He is on a mission to change the way autoimmune disease is treated worldwide to improve the quality of life for patient, practitioner, and future generations. He can be located at www.drdavidbilstrom.com. I hope you enjoyed this episode of Cold Press Conversations. If you love this episode as much as I did, I need you to head on over and subscribe so you never miss an episode. This is Dr. Jewel signing off to health and cognitive happiness.